Good day, everyone. Today we will be covering professionalism in medicine, the role of honesty. Our learning objectives include being able to list and describe the key components of honesty, certainly including truthfulness, avoidance of cheating or plagiarism, and maintaining confidentiality, both in a clinical and an academic setting. Furthermore, we expect students to demonstrate honest behavior by accurately reporting errors and refraining from misrepresentation in simulated scenarios, thereby justifying their actions based on professional ethical standards. We have our key components of honesty listed here. The first being be truthful in communication with others. Certainly do not cheat, do not plagiarize or misrepresent in the fulfillment of academic requirements. Trustworthiness in a general setting, not just with patients, but certainly, with friends, family, and coworkers. Maintaining the confidentiality of patient information, including not just electronic devices such as phones or iPads, but rather patient information that includes photos, x-rays, labs, and other documentation that may directly be relevant to the patient that you are currently consulting. Maintain confidentiality of student assessment and evaluation information. And finally, admit errors and don't intentionally mislead others or promote yourself at the expense of a student or peer or other professional colleague or patient. Before beginning the actual module, we need to define what honesty is. At its simplest, it's essentially the commitment to truthfulness, integrity, and ethical behavior in clinical and medical practice. Some of the key areas obviously include truthfulness, being able to provide accurate information without deception, maintaining academic and research integrity by avoidance of cheating and plagiarism, and finally, maintaining confidentiality, knowing when to uphold those ethical standards in patient care. You don't want to divulge that information unnecessarily, only when it's actually used for the fulfillment of a patient's standard of care or their own treatment plan. Honesty is important for many reasons. Certainly, I would say patient safety tends to be one of the highest reasons for why you want to make sure to remain honest in medicine. It fosters trust, certainly between physicians, allied health personnel, patients, and certainly other colleagues. There are certainly legal and ethical obligations that are to be found. Dishonesty when you are documenting in medical records, or certainly billing, which can lead to fraud. Or certainly if there's been some type of dishonesty in the patient care itself, can lead to malpractice lawsuits and has led to loss of licensure for many clinicians. Medical culture and teamwork involves interdisciplinary collaboration. Quite frankly, we can't function as solo providers anymore. We are functioning in a team, and therefore it is important for effective communication and teamwork that we remain honest. We have our first case study here, generally something that many of us would call a white lie. Dr. Jane, a resident, was running late for rounds. To avoid looking irresponsible, she documented patient vitals from memory instead of checking the patient's actual chart. Later, a patient's deteriorating condition was missed due to inaccurate vitals.
Let's examine how shortcuts in documentation, no matter the intention, can put patient safety at risk. Was Dr. Jane's actions justified?
No. While running late can be stressful, fabricating clinical data is never acceptable. Patient vitals are critical to care decisions. Documenting from memory violates both ethical standards and clinical safety protocols.
How could this error have been prevented?
Time management, building in margin for unexpected delays could have helped. Team communication. She could have alerted the team that she was running behind and asked for help with vitals collections. And lastly, professional integrity. If unable to assess vitals personally, she should have left the section blank and followed up promptly.
Thank you.
Documenting clinical encounters. This is another aspect where honesty is also important. You want to make sure never to fabricate patient encounters in logs or charts. We may be rushed for time when we're in clinic. Many of us may end up having many patients in the lobby or even in the hospital when we're doing rounds. You want to make sure that you don't just document that you consulted a patient when you didn't. Again, that's a false encounter, and that would be considered fraud, certainly if you end up documenting something that you didn't do, but you ended up documenting it in the chart. Um, Inaccurate documentation certainly affects patient safety and can end up affecting their treatment decisions. Um, Ethics when you're dealing with exams and skill performance, it's okay to admit when you don't know how to perform a certain procedure or exam. Don't pretend that you know how to do it because you may end up causing more harm to the individual. Misrepresenting clinical skills can actually endanger patients in real world practice. If you don't know how to do a lumbar puncture, don't do it. Ask the supervising physician or one of your colleagues to show you how to do it first. That way you know how to do it on future on future encounters. Don't practice on a patient unnecessarily. We have an example of this in this case study. A medical student eager to impress performed a central line placement without sufficient training. The patient developed complications due to improper technique.
In clinical settings, the safest provider isn't the most skilled, it's the most honest. Should the student have admitted inexperience?
Absolutely. Performing a high risk procedure like a central line without adequate training puts patient safety in jeopardy. The student should have said something like, I've observed this before, but I haven't performed it. Can I assist or observe this time?
What are the consequences of dishonesty in skills performance?
Patient harm. Complications like infection, bleeding, or organ injury can occur, not to mention the loss of trust. Supervisors may hesitate assigning responsibilities again. Legal and academic consequences. Failing to disclose inexperience can lead to disciplinary actions.
Thank you.
Avoiding plagiarism and cheating. Certainly, using someone else's words or ideas without proper attribution would be the definition of plagiarism. I will note this can also include self plagiarism, where you reuse your own previous work improperly. Um, but moving further than that, cheating in medical school or PA school in this case, sharing test answers, using unauthorized materials, or falsifying assignments is not going to improve the integrity either of the profession, the department, or even your own integrity as well. Because at the end of the day, did you really learn the information? And if you haven't really learned it, you may have passed the exam, but when you start getting into real world encounters, this is where actually knowing the content of the work that you studied in PA school comes into play. If you don't really know what you're doing, you're going to end up wasting more time. In worst case scenarios, you may end up hurting the patient. And so, loss of integrity here can lead to unprofessional behavior in the future when you're practicing as a PA in your own clinical practice. An example of this, a group of students obtained a previous year's exam to study. Some of the exact questions appeared on their test, giving them an unfair advantage.
Let's talk about fairness, honesty, and doing the right thing, even when no one's watching. Is studying old exams unethical?
It depends. If past exams are officially released by faculty as study aids, then it's appropriate. But if students obtain unauthorized copies, that's where it can cross a line.
Would reporting to students be the right thing to do?
Yes, while it may feel uncomfortable, reporting maintains the integrity of the program and protects your future students and patients. Unfair advantages today can lead to dangerous gaps tomorrow.
The role of confidentiality. So, HIPAA compliance is certainly important. I believe many of you all are familiar with HIPAA and the importance of making sure that patient health information remains confidential and is only divulged under certain conditions. Um, some examples of some breaches that have occurred include discussing patient cases in public spaces, a hallway, elevator, social media, bathroom. You want to make sure that if you are discussing this information, it's with the right person to begin with. And two, that if you are discussing it, that there is some measure of confidentiality that is taken care of. You kind of close the door to your office, making sure that other individuals cannot hear what is being said. Improper access to EHR without clinical justification is also a breach of HIPAA. And so this might be an example of maybe, say, leaving your computer screen open when you go see another patient in an, say, in an open environment. Instead of logging off each time, just for convenience, you kind of leave the computer open. Someone, walks by and they can actually see the information that's there for a patient that you're actually treating. Again, someone who's not supposed to have access to that specific information. So again, you want to make sure that only people who are uh, currently treating the patient or who have access to that information, uh, again, are continuing to have access to that information. Someone who does not have that authority should not be seeing, patients' confidential information. An example here, a resident physician in this case posted a story about an interesting patient case on social media, omitting certain patient details. However, the patient's family recognized the case.
Let's explore why even anonymous posts can compromise patient trust and what professionalism looks like online. Was this a violation of confidentiality?
Yes. Even though the resident omitted specific identifiers, the story was detailed enough for the family to recognize it. If a patient or someone close to them can identify the case, it violates HIPAA and professional standards, even if names and photos aren't shared.
How can medical professionals use social media responsibly?
Quite simply, avoid posting about patient encounters, even vaguely. Separate professional and personal accounts, but still follow ethical guidelines on both. Educate yourself on institutional guidelines on media policy, not to mention HIPAA guidelines as well. Ask yourself, if a patient saw this, would they feel respected?
That seems pretty reasonable.
Reporting errors in clinical practice. Transparency in medicine is important. We're all human, and certainly if a mistake does occur in medicine, we want to make sure that we own up to it. Um, this is important because it will improve patient safety and it prevents future mistakes like this from occurring. So don't try to hide it. If there is something that happened where you messed up, make sure that you address it as soon as you find out. And make sure that the relevant individuals are made aware of this mistake so that the patient is not harmed. Fear of reporting errors. Oftentimes we're scared that, if we end up reporting an error to our supervising physician or to a colleague, that they'll end up disclosing that error and that there's going to be some type of punitive action. I can't say that there's not going to be some type of punitive or corrective action that takes place. Certainly, we hope that a patient is not hurt or damaged in any way. But in the event that that happens, that may be something that ends up occurring. In this case, consider it something more as a learning experience, something to where you'll make sure that this never happens again. At the end of the day, all institutions and individuals working in a hospital are trying to promote a culture of learning. And so that's really what we're trying to get at. We want to make sure that we're trying to continually advance the practice of medicine in ways that are beneficent towards a patient. Case study. A nurse administered the wrong dose of insulin to a patient, causing hypoglycemia. The physician discovered the mistake but hesitated to report it for fear of repercussions.
Even well meaning silence can lead to harm. Let's discuss how transparency protects patients and upholds professional integrity. What are the ethical obligations in this situation?
Well, both the nurse and the physician are ethically and professionally obligated to report the medication error. Patient safety comes first, and transparency is essential for accountability, trust, and system improvement. Failing to report violates professional codes and can endanger the patient further.
How does error reporting improve patient safety?
Well, it triggers appropriate monitoring or treatment to prevent harm. It identifies system failures, maybe unclear labeling, staffing issues, just so that all that can be corrected. And finally, it promotes a culture of safety where team members feel supported in reporting concerns without fear.
That sounds great.
Avoidance of misrepresenting yourself in medical practice. Some examples of this would include exaggerating clinical experience on residency applications. This happens no differently for us as physician assistants. You know, we're trying to perhaps obtain a position that we have been longing for many years, perhaps. Maybe we saw an opening come up in dermatology or cardiology, and so we misrepresent the fact that we are proficient in certain procedures within those specific fields. As it turns out, we actually are not proficient in those fields. You know, I only did that when I was in PA school. But you end up putting that in your CV. You're misrepresenting your abilities to your potential future employer. They may hire you thinking that you already know how to do this. As it turns out, you don't. And now they have to take more time to teach you. In certain situations, they may actually fire you because you actually misrepresented yourself and would have grounds to do so. So, falsifying procedural experience to meet certain requirements, to get hired, or perhaps to obtain maybe a higher salary or whatnot, it uh, should be not just frowned upon, but should be something that we strive to correct and make certain that we're going to represent ourselves honestly and truthfully. Again, integrity is of the utmost importance whenever you're dealing with patient safety. Consequences of dishonesty in this case involve loss of credibility and trust. You know, someone is counting on you to do a lumbar puncture, endotracheal intubation. I mean, you put that on your CV. You've done countless numbers of these. So it turns out you've only done one of each during PA school, but you put here that you've done close to 50 or 60 of each, quite proficient in them. Okay, you get thrown into an environment where you are required to do one maybe on your first day of work, and now they find out you can't do that. You've essentially, you know, come out and you've impaired the entire department because now it's like they're counting on you to do something that you cannot do because you misrepresented yourself. Again, this can result in disciplinary action. You can get fired. In some cases, you can actually end up losing your license. A revocation can actually occur in very severe cases. So, again, think carefully before you try to misrepresent your abilities um, at any stage of the clinical process. The next case study, you observe a fellow student chart a patient encounter that never actually took place. They tell you it's just to keep things moving and that it's harmless.
Let's unpack why every note matters and how to respond when someone crosses the line. What are the ethical concerns in this situation?
Well, falsifying documentation is never harmless. It's fraud. It jeopardizes patient safety, legal standing, and the institution's credibility. It also reflects poorly on everyone involved, including peers who remain silent.
How should you respond while maintaining professionalism?
I would say speak up calmly and privately say something like, I noticed that chart note and I'm concerned it wasn't accurate. We should clarify that with the preceptor. Don't accuse, maybe seek clarity, give them a chance to self correct. If they refuse, at that point, go ahead and report the incident to the appropriate channels. Silence equals complicity.
What institutional resources could help address this?
Preceptors and clinical instructors, ethical committees, or an ombudsman, academic integrity offices, or even professional review boards. All of these certainly play a role in this.
Challenges in ethical honesty. I'll say that sometimes in clinic, we have to break bad news to patients without causing them harm. You know, it's difficult to tell someone that they've been diagnosed with cancer, that they have maybe some type of chronic neurological condition, maybe Alzheimer's, Parkinson's disease. These are not easy conversations to have. And so tact is certainly important, trying to make sure to validate their concerns and just make certain that, you're addressing this with as much sympathy and if possible, perhaps empathy as well, depending on the condition, so that you can, make certain that you're able to decrease the harm that the news of them receiving this will cause them. It's not easy hearing that you have cancer, either to yourself or knowing that your loved one, a child, a spouse, may end up having this. And so you have to make certain to discuss it, firmly, appropriately. And you also want to make sure that you don't mislead the patients. Don't try to sugarcoat the issue either. If they have cancer, make sure that you tell them that they have cancer. And so there are ways of navigating this type of moral distress when, conflicts of honesty with institutional pressures can arise. You may want to, try to decrease the pain that the individual has by not fully telling them the entire situation or the gravity of the situation. In some cases, that makes it worse. Sometimes you have to make certain that you kind of weigh the situation. But honesty in this case doesn't actually hurt. Telling them what they have and then being there for support tends to be some of the best ways to actually manage critical situations such as these. Principle of beneficence, acting in the patient's best interest. The principle of non-maleficence, do no harm. And finally, truth-telling, ensuring transparency in medical information. If you follow these three principles, these frameworks, I've generally found that this has carried me well throughout my clinical career and even my academic, career as well. And it, not just, a medical setting, but certainly an academic setting as well. I would argue this is applicable to all sectors or industries, throughout the world. If you follow these three rules, uh, generally it's best practice and it tends to avoid trouble, as much as possible. If you do deal with mistakes, you want to make certain that you're actually reporting all the errors. Um, Making sure that the errors are reported is important because it's going to promote patient safety and prevent future mistakes. If there's some type of structural or procedural issue going on, this can actually be addressed, and there are ways where we can actually end up changing the way the procedure is performed, maybe adding in another step or cutting certain steps, and that ends up making the process more efficient and thereby improves patient safety. It builds a culture of trust and learning in medicine. Some barriers to reporting errors, again, fear of punishment. Maybe you're just worried that you're going to get reprimanded, you might lose your job. Depending on the severity, you might lose your license. Or there could be legal consequences, some type of lawsuit that occurs. At the end of the day, we must face these issues head on. If an error occurred, make sure that you address it as soon as possible and make sure that the individuals who were harmed, hopefully they weren't, but if they were, make sure that they are made aware of it. Again, the patient's safety is paramount. All right, you want to make certain that the patient does not lose trust because it's not just going to be you who's affected. The patient may lose trust in the entire institution. In some cases, just in the entire field of medicine. It's like, they're all like this. Again, you know, by owning up to your mistakes, this tends to make it a lot easier to move on from what has occurred. Best practices, again, report mistakes immediately, transparently, engage the root cause analysis to prevent recurrence, and then foster an environment where honest error reporting is encouraged. Billing issues. Certainly, this is probably one of the most common reasons why clinicians have, been accused of a fraud. In many cases, perhaps overbilling. Say overcoding. And so you do have, examples of it here. Upcoding, charging for a more complex procedure than was performed, unbundling, separating services that should be billed together, and billing for services not provided. All of these are examples of fraud, essentially, that can result in a physician or a clinician to end up having to pay back the money in something called a clawback. Not to mention to where you can end up having revocation of privileges, and depending on the severity, again, you may end up, serving prison time as a result of this. Consequences of dishonest billing, again, can include legal penalties, loss of medical license, increased healthcare costs for all patients, because now, the procedure itself is actually resulting in more cost to Medicare. And so this is, again, coming from taxpayer dollars, you're defrauding essentially the Medicare system. Best practices for ethical billing, again, just use accurate codes for whatever procedure you are performing. Audit your billing practices regularly, perhaps quarterly, and ensure patient transparency in medical costs. How do you recognize and address plagiarism? Well, again, plagiarism is using another person's words or ideas without citation, including your own, without disclosing that they are your own words. It matters because, again, it violates professional and academic integrity, damages trust and credibility in research. To avoid it, just properly cite all sources. It's as simple as that. You can end up using new AI plagiarism detection softwares just to determine whether or not everything has been properly cited. And when in doubt, you can always seek guidance from your mentors, to find out what the best practice is. Finally, balancing truthfulness with patient privacy. Medical professionals must be truthful while respecting confidentiality. HIPAA violations can occur when sensitive patient information is shared without consent. If confidentiality must be breached, there has to be a good reason for it. Again, if a patient poses a threat to themselves or others, mandatory reporting, certainly in the case of certain infectious diseases, tuberculosis, for example. Abuse is certainly another reason where breaching confidentiality would be justified. And finally, if there's a legal order that has been obtained and demands disclosure, at that point you do have to go ahead and release the information. Again, when in doubt, seek ethics consultations for complex cases and follow your institutional legal guidelines. Lastly, as a commitment to honesty in medicine, you can ask yourself certain questions. When have I faced certain ethical dilemmas? Not just in medicine, but just in your own life. Perhaps there was something that was said in confidence to you in high school or in college, or perhaps you've worked some other professional job in the past, and someone came to you, and so it divulged information that perhaps puts you in a gray area or a difficult position as to whether or not you should actually say anything. Again, this isn't just limited to just medicine. This occurs in daily lives as well. How would you handle a situation where honesty is difficult? And what strategies would you use to uphold honesty throughout your career? Again, as a takeaway, I would say, honesty remains the foundation of medical professionalism because it fosters trust throughout the entire medical field between patients and clinicians. Ethical challenges require self-reflection and integrity. And finally, by developing lifelong habits, this will strengthen trust in patient care. The next section that we will cover is professional demeanor.